Have you ever wondered if the cold pill you just bought at the pharmacy could be a silent threat if you are already taking blood pressure medication or heart pills? The life of Mr. George, a meticulous and cautious man, was nearly ended by a seemingly harmless cold tablet. This story will not only tell you about a dangerous incident, but will also provide you with 3 essential lessons to become your own medication detective. Because at our age, understanding medication labels is a survival skill. Mr. George, 68, lives in a quiet house in Florida, USA. He is a man who is meticulously careful about everything, except when it came to reading over-the-counter OTC medication labels. Every morning he neatly arranged his pills: a blue one for blood pressure, a small white one for his heart, and a blood thinner. He never missed a dose. He prided himself on being a model health manager. But there was one thing Mr. George never suspected. His carefulness stopped only at prescription drugs. It all started on a Wednesday afternoon when Mr. George caught a cold. His nose was stuffy and his head ached. He went to the pharmacy and asked for a common cold remedy. He glanced at the brand name on the box, saw the words pain relief and decongestant, and was satisfied. He didn't bother with the tiny printed list of ingredients on the back, thinking, it's just a cold pill. No prescription needed. He paid and went home, taking the first cold pill at the same time as his afternoon blood pressure dose. A few hours later, while watching the news, Mr. George felt something was terribly wrong. His heart began to pound heavily, a feeling of rapid, uncomfortable throbbing. He felt intensely dizzy, as if the whole room were spinning. He tried to get up but had to clutch the armchair for support. A sudden, intense fear washed over him. He recalled that he had never had these symptoms before, especially after taking his blood pressure medication regularly. His daughter, Sarah, a nurse working at the local hospital, rushed over immediately when she heard her father was short of breath and had a rapid heart rate. Sarah, sharp and composed, immediately checked her father's blood pressure. The number displayed was alarmingly high, far above his normal range. "What did you take besides your usual pills?" Sarah asked with a serious tone. Mr. George pointed to the new cold medicine box on the table. Sarah picked up the box and quickly scanned the label. Her face went pale. She pointed to the active ingredients on the cold medicine box. "Dad, this cold medicine contains pseudoephedrine," Sarah explained. "That is a strong decongestant. It works by constricting blood vessels, and it can interact extremely dangerously with your blood pressure medication, causing a sudden spike in blood pressure and rapid heartbeat." Mr. George was stunned. He had taken the pill without realizing he was introducing an enemy into his body. But that wasn't all. Sarah checked his other medications. She saw he was also taking a separate, over-the-counter pain reliever he bought for his shoulder pain. Sarah checked the ingredients of that pain reliever and compared it with the ingredients in his heart and blood pressure medication. "Here is the second trap. Dad," Sarah sighed. "This pain reliever contains acetaminophen, but your heart pill already has a small amount of this substance. You have accidentally taken a double dose of the same active ingredient, exceeding the safe limit, which puts immense stress on your liver and kidneys." Mr. George's mistake was not due to carelessness but to complacency and the complexity of the modern pharmaceutical system. According to pharmacology experts, one of the leading causes of drug-related emergency room visits among older adults is drug interaction due to taking OTC medications without checking the active ingredients. Mr. George, though, out of immediate danger, learned a painful lesson. His meticulousness was not enough. He needed to become a true medication detective. After the incident, Sarah sat down with her father and turned the living room into a small classroom on medication safety. Lesson 1. The active ingredient trap. Sarah placed all of her father's medications on the table: prescription pills, vitamins, and OTC meds. Rule number 1. Find and circle the active ingredient, Sarah emphasized. She explained that drug companies often use different brand names, but they contain the same active chemical, for example, ibuprofen, acetaminophen, diphenhydramine. You must treat them as the same medication. Never take 2 medications with the same active ingredient at the same time, without consulting a doctor or pharmacist. That is the easiest way to cause an overdose and damage your liver and kidneys. She showed him how to check the uses and warnings sections on the labels to see the active components and maximum dosage. Lesson 2. The drug interaction warning box. Sarah continued the lesson on drug interactions. She picked up the cold medicine box and pointed to the warnings section. She showed him the fine print. Ask a doctor or pharmacist before use if you are taking a prescription drug for high blood pressure. This is the most crucial warning box for your age, Dad. If you see this line, stop immediately. She expanded the lesson to drug-food interactions. "Do you remember grapefruit, Dad?" Sarah asked. She explained that, according to studies, grapefruit can interact strongly with statins, cholesterol-lowering drugs, and some blood pressure medications, dangerously increasing the drug concentration in the blood. This interaction can turn a safe dose into an overdose, causing harm to muscles and the liver. Mr. George nodded, his face showing clear remorse. Lesson 3. The pharmacist is your hero. Medication is not something to self-discover, Dad, Sarah concluded. She stressed the importance of an annual medication review. She called Dr. Emily, the family pharmacist, and scheduled an appointment. Dr. Emily helped Mr. George review his entire medication list, removed outdated pills, and created a simple medication safety log. Dr. Emily explained that, when a senior patient takes 5 or more medications, the risk of drug interaction increases by 8-fold. She prescribed a safer cold remedy for Mr. George, one without decongestants, and placed a large warning sticker on his blood pressure medication box. Do not use with pseudoephedrine cold medicines. Mr. George, despite the major scare, regained his confidence. He was no longer a passive patient. He had become an intelligent medication detective, always checking, always asking, and always prioritizing safety. He understood that at this age, knowledge about medication is the most precious asset, worth more than gold. And you? Are you a smart medication detective? Or are you accidentally making these potentially deadly mistakes? Share your experience in the comments below. Don't forget to like, share, and subscribe to our channel so we can live joyfully, healthily, and safely.